Welcome to an overview of measles, also known as rubeola. This video will cover its symptoms, transmission, and prevention. Measles is a highly contagious viral illness caused by the morbillivirus. Understanding its biology and clinical course is vital for early recognition and prevention. Let's first look at how the virus incubates and spreads among the population. The incubation period, from exposure to the first symptoms, is typically 7 to 14 days, often around 10 to 12 days. During this time, the virus silently replicates in the respiratory tract and lymph nodes. Crucially, patients become contagious approximately 4 days before the rash appears. Measles spreads easily via airborne droplets and aerosols from coughing or sneezing. The measles virus can remain active in the air or on surfaces for up to 2 hours. It's one of the most contagious human infections, with one case potentially infecting up to 18 others. Humans are the only known reservoir. Now let's explore how the virus progresses through the body after initial inhalation. After inhalation, the virus first infects respiratory cells and macrophages, leading to local replication. It then spreads to lymphoid tissues like lymph nodes and the spleen in what is known as primary viremia. Secondary viremia follows, where the virus is disseminated widely throughout the body to the skin, conjunctiva, respiratory tract, and other organs. The classic maculopapular rash is actually an immune-mediated response, caused by T cells targeting infected cells, rather than direct viral damage. Measles also causes transient immunosuppression, increasing the risk of secondary infections for months. What are the common symptoms or clinical features of a measles infection? The prodromal phase, lasting 2 to 4 days, is characterized by high fever and the 3 C's: cough, coryza, which is a runny nose, and conjunctivitis or red eyes. A key diagnostic sign that appears before the rash are Koplik spots, which are tiny bluish-white lesions found on the buccal mucosa opposite the molars. In the exanthem phase, the maculopapular rash begins at the hairline and face, then spreads downward to the trunk and limbs, fading in the same order it appeared. Finally, let's review how measles is diagnosed, the potential complications, and the standard treatment protocol. Diagnosis is often clinical, based on the classic fever, rash, 3 C's, and Koplik spots. Confirmation is done through measles-specific IgM antibodies, or PCR testing, from throat or nasopharyngeal samples. Complications are more common in high-risk groups, including infants and immunocompromised patients. Serious risks include pneumonia, which is a major cause of death, and life-threatening conditions like encephalitis. There is no specific antiviral cure for routine measles, so treatment is mainly supportive, focusing on hydration, nutrition, and antipyretics for fever. Vitamin A supplementation is also recommended, particularly in children, to reduce morbidity and mortality. Prevention is the most critical aspect of managing measles, primarily through vaccination. The MMR vaccine for measles, mumps, and rubella is highly effective. 2 doses provide approximately 97% protection against the disease. Post-exposure prophylaxis can also be used in certain cases to lessen disease severity. Measles is highly contagious and severe, but it is preventable. Remember the importance of the MMR vaccine to protect yourself and your community from this serious illness.